namely that antidepressants often do not do what they promise and are in fact causing harm to many.
Dr. Steve Hotze is suing over Obamacare's employer mandate.
It's time for a wellness revolution. Brought to you by Hotze Health and Wellness Center. Honest discussion on maintaining health and wellness naturally to enjoy a better quality of life.
He's the doctor fighting to let you keep your doctor.
Now, Dr. Stephen Hotze.
Welcome to Dr. Hotze's Wellness Revolution. I'm Stacey Banfield here with Dr. Steve Hotze, founder of the Hotze Health and Wellness Center. And as always, you can download any and all of our podcasts at hotzepodcast.com. That's Hotze podcast.com. Well, a very common problem that we find with women is infertility. They call us all the time about it. And a lot of times people do look at it as if it's a riddle, a puzzle, very complicated, why I can't get pregnant. But then when you really get to the heart of it, there are two main reasons why a lot of women aren't getting pregnant. Isn't that right, Dr.
Right.
Hotze?
Infertility, of course, can occur because a woman is unable to conceive. Maybe she doesn't ovulate properly, or the fertilized egg doesn't stick to the womb, and she can't get pregnant for that reason, or she has miscarriages. So women can have problems, and we're going to talk about female problems causing infertility, but of course men can have problems as well, infertility problems. So it takes two to tango, they say. But we're going to talk primarily today about female infertility. Now, female infertility is a direct result from an imbalance and improper production of the female sex hormones and thyroid hormones. So one of the causes that women have problems with infertility is because they have poor production and poor balance of the sex hormones, or secondly, they may have poor production or poor utilization of thyroid hormones. And these may work together synergistically to enable a woman to become pregnant. And if they're having problems with one, that can having problems with your female hormones may be causing you to have problems then with your thyroid hormone function, and vice versa. So the hormones work together synergistically. Let's talk about the normal female cycle. There are two phases. They're called the follicular phase, and that's where the ovaries make primarily estrogen hormones. And there are three estrogen hormones. There's estrone, estradiol, and estriol, all three made by females, human females. And those hormones are made in the first half of the month primarily, although they're made all month long, but they rise starting on at the end of the menstrual period. The body begins then to secrete from the ovaries these estrogen hormones, which are proliferative hormones. They cause proliferation of tissue in the inner lining of the womb or the uterus, and it causes it to beef up and become bulky as you would prepare soil for seeds. Well, the seed, if it's fertilized, is the ovum, which comes from also comes from female ovaries. That ovum is then transmitted or travels down the fallopian tubes into the womb. It may be fertilized if intercourse has occurred during that time. The egg is given off when ovulation occurs, which is at about day 14 of the menstrual cycle. Menstrual cycle normally has 28 days. Day 1 is the first day of the period. Day 28 would be the last day before your period. That's the normal cycle. Some women, it's every 30 days. Some it's every 25. It may vary. But on an average, it's every 28 days a woman will go through her cycle. And so the first 14 days are the follicular stage. That's when she's producing estrogen hormones singularly. Then she ovulates, and she begins to produce from the area where the egg erupted out of the ovary and then travels into the fallopian tubes from that area. That's called the corpus luteum. And it secretes progesterone. And progesterone matures the tissue. It balances the estrogen. It prepares it for a pregnancy. Progesterone literally means promoting gestation. Gestation is a pregnancy. So it promotes pregnancy. So it gets the inner lining of the womb. Once it's been beefed up, then it matures it, getting ready to have the fertilized egg implanted. If there's no fertilized egg implanted, then the body will quit making from the ovaries. In a woman's body, she quits making her hormones, and then she sloughs the inner lining of the womb, and the whole thing starts over. It's a cycle. So there's a cycle on this. So if a woman does not ovulate, or if she does not produce adequate amounts of progesterone, then she will not be able to promote gestation. She will not be able to maintain a pregnancy. And so this is a common problem in women, particularly having miscarriages. They are not producing enough progesterone. So women that have had this problem will oftentimes see their physician, and they will prescribe for them progesterone. And they give it oftentimes in the form of injections that they'll take on a frequent basis to help maintain progesterone levels high enough that the pregnancy is maintained. Now, as a woman marches through her menstrual life, which starts, let's say it starts at age 14. Some women it starts younger than that, some women a little bit older. But let's say average age would be about 14, 13, 14 when a woman begins her menstrual cycles. Well, women can have problems early in life with irregular cycles, with mood swings. When women don't make enough progesterone, they don't balance out the estrogen, and they have what we call estrogen dominance. This can occur at puberty. It can occur in a woman's 20s, 30s. By midlife, it will happen. In 35 to 40, women will begin to notice where they have symptoms of estrogen dominance, which are their periods may get heavier, they may be irregular, they'll get fluid retention, they'll get weight gain, they'll get breast tenderness, they'll get headaches, and it usually occurs just before they have their menstrual period. So it may occur 1 or 2 days before the periods. It may occur then as time goes on over years. It may occur 3 or 4 or 5 days or a week or 2 weeks. And some women say, I know when right in the middle of my cycle, I begin to develop these symptoms. And those are signs and symptoms of progesterone deficiency. And the opposite side of that coin is estrogen dominance. So even as a woman ages, the progesterone levels fall much more dramatically than the estrogen levels fall. And so they have estrogen dominance. Even if estrogen levels have fallen, the estrogen is the dominating hormone. And that causes these premenstrual symptoms, which can be easily ameliorated and eliminated using natural progesterone. So when women have these premenstrual symptoms, that's a sign of hormonal imbalance. When women's periods get longer and heavier and they begin to get clotting and the breakthrough bleeding and fibroids, that is a classical feature of estrogen dominance, and the opposite side of the coin being progesterone deficiency. So if a woman's, that's why women tend to be more fertile when they're younger. As women age, the ovaries age, and they don't ovulate every month. And there'll be times women will tell me, they'll say, well, I have a regular period, every other month it's regular, but then the next month it's very, very heavy, and then it lightens up the next month, and it never was like that. Well, she's not ovulating that month. So all she has is the impact of the proliferative hormone estrogen. And so when she has her period, it becomes that much heavier, it lasts several days longer, and may end up with clotting. And then when she doesn't ovulate at all, as the ovaries get older into her early to mid-40s, she'll miss ovulation. That's why older women have a harder time becoming pregnant, because they don't ovulate every month. And then the primary hormone that's governing their menstrual cycle is now estrogen, so they have this chronic pressure on the uterus without any balance. So they have this proliferation. That's when they get the fibroids and the breakthrough bleeding and the clotting. And that's when they often turn up at the doctors, and they go, you got to stop the bleeding. They may try birth control pills. Those have problems of their own. Mm-hmm. But oftentimes the doctor, the OB-GYN, remember OB-GYNs are primarily surgeons, so once they deliver your babies, lady, the next procedure they want to perform on you is a hysterectomy. That's what they're trained to do. Early in their career, they deliver babies. Late in the career, they do hysterectomies and bladder suspension. So they're going to recommend that you have a hysterectomy. Now, it's the progesterone deficiency that is a primary cause of infertility, and more specifically with miscarriages, when the body doesn't produce enough progesterone to maintain that pregnancy. So progesterone deficiency can be a big problem. So it's important to balance out your menstrual cycles. And if you're trying to get pregnant and having a problem with it, before you see an infertility specialist, you ought to see fertility doctors like those of us at Hotze Health and Wellness Center, because we know how important it is to get your hormones in balance. Now, the second most important hormone, or maybe it's the most important hormone in pregnancy to ensure that you can get pregnant, is your thyroid hormones. Remember, the thyroid hormone is produced by the thyroid gland in the neck, and it enters the bloodstream, doesn't do anything in the bloodstream. No matter how much thyroid you have in your blood, it has to enter your cells. And the thyroid hormone in the blood is primarily the inactive thyroid hormone called T4. It has 4 iodine atoms attached to it. It's T4. It's inactive. It has to enter the cells, and in the cells, one of those iodine atoms has to be cleaved off, and there's an enzyme that does that. That's the deiodinase enzyme. It cleaves off one of the atoms of iodine, and now you're left with T3. That's the active thyroid hormone. That's what activates the power plants in the cells, the mitochondria, and enables them to produce energy. So if an individual has the signs and symptoms of low thyroid, and those would be fatigue, frequently difficulty with weight, inability to focus and think clearly, cold body temperature, lower than 98.6 when they're up during the day. We often see individuals when they come into our office, 97s, 96s even. So they're running cold. That tells us they're not producing enough energy within the cells. The excess energy that's produced within the mitochondria is given off as heat, and that's what gives your body a temperature. And the best temperature at which all the biochemical processes in the body works is 98.6. So also, if you don't get enough thyroid, you can have mood swings, you can have irregular menstrual cycles, you can have joint muscle aches and pains, abnormal bowel function. You may be prone to infections. You get puffy, pasty, pale. Women's hair will begin to fall out. And commonly, these women will have problems with fertility. So they end up going to see an infertility specialist who takes a bunch of eggs off and tries to, get the eggs fertilized in a petri dish and then reimplant them in your body and then pump you full of a bunch of hormones that are counterfeit hormones, they're not natural hormones, to the tune of $40 or $50 or $60,000. When they call them infertility clinics or infertility specialists, because only 25 to 30% max ever get pregnant. They are infertility clinics. I've noticed some have started to change their name since we've been talking about fertility. So while we're not an infertility clinic, we do help women balance out their hormones. And we know it's important for hormones to be balanced in order for you to be in the physical state to be able to become pregnant. And we have helped numerous women, even women that have gone to infertility clinics. They come to us because I went to the infertility clinic. I couldn't get pregnant, but they got my hormones all screwed up. And we help regulate their hormones. And we've had wonderful successes with that. So 2 major hormonal causes that will lead to infertility. One is declining ovarian function and a declining production of progesterone and anovulatory cycles. Second thing is low thyroid function, which governs your body's metabolism. Think about it. If the thyroid hormone governs the metabolism of all the cells in your body, it's going to affect your ovaries, ladies, and the function of those ovaries and their ability to produce the egg or the ovum and properly ovulate. So if you have poor thyroid functions, your ovaries aren't going to work well, and you're going to be more likely, or less likely, I should say, to be able to become pregnant. You're going to tend to be infertile. So these are two easy adjustments that can be made. Balancing with progesterone. By the way, progesterone also enhances the function of thyroid hormones. When a person or a woman is progesterone deficient, she's estrogen dominant, that adversely affects the ability of the cells to be able to utilize thyroid hormone. So those are two things that can be done to overcome. Now, let me mention one other thing that can be done besides the hormones is clean up your eating program. Eat healthy, eat organic foods, drink healthy. So that means drink filtered water. Stay away from canned drinks or other drinks that have all these chemicals in it. If it's in a packaged bag or a box, don't eat it. Eat whole foods, green vegetables, good healthy oils, good healthy fats, and exercise. But it's the petrochemicals and don't slather your body with a bunch of these lotions you buy at the local drugstore or the food market. They're full of petrochemicals. If you read them and they got all these chemical names, those are petrochemicals. They get in your system, and the petrochemicals are counterfeit estrogens. They're called xenoestrogens, and they disrupt hormonal production in your body, and they disrupt the receptor sites. So that can be a big problem. That's why if you want to get pregnant, not only do you have to balance your hormones with progesterone and thyroid, but you need to take good vitamins and minerals and nutrients to help your cells detoxify from the chemicals that you get from what you breathe, eat, drink, lotions that you slather on your body. That's really important. So vitamin and mineral supplementation is important as well. Well, I want to thank you for joining us today. And remember, I believe that you and every individual needs a doctor and staff of professionals to coach them onto a path of health and wellness naturally. So as you mature, you enjoy a better quality of life. Does that make sense? If it does, then give us a call.
Absolutely. The best choice is the natural choice. We've got a great resource for you at Hotze, HWC.com. That's HOTZE, HWC.com. You can take our symptom checker, see if you might have some of the symptoms and signs that Dr. Hotze is talking about. And, of course, you can always give us a call at 281-698-8698. We'd love to have a conversation with you and your health, about your health, and that's 281-698-8698. We're so glad that you joined us today here at Dr. Hotze's Wellness Revolution.
Information provided on this radio program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution radio program advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this radio program is at the listener's discretion.